I'm Dr. Sharon Bloom from Elite DNA Therapy Services. I'm the Chief Clinical Officer and a licensed psychologist, and I'd like to welcome you to Elite DNA's Mental Health Minute. Here with me is my co-host, Phil Cerrone, who is our Chief Operating Officer. Hey, Phil, what's going on?
Hey, Dr. Bloom, how are you doing today?
Good. We've got a good show today with our guest. You want to introduce our guest?
Yeah, so Sasha Navas is one of our licensed clinical social workers. How are you, Sasha?
I'm good, Phil.
Sasha is amazing. Not only is she a clinician who's been practicing many years, but because of the amount of language that she speaks 7 different languages. So she works with all different populations, whether it's patients with anxiety, patients with trauma, family counseling, divorce. She has seen and done it all. So very lucky to have you on the podcast today. And I have a question for you specifically relating to all that's going on right now. So when we spoke last week, you had mentioned some of the things that you're doing with your patients, and I think it'd be so great for our listeners or viewers to kind of hear that really trying to get at what are some of the positive things, the things that you're doing with your patients that are allowing them not to focus on all that's going on, whether it's social isolation, all the fear that's out there, the anxiety, the depression of maybe being unemployed. How are you working with those patients, and what unique things are you doing to help them?
So it's been a really unique time, I think, not just for, Elite DNA, but in history. And my clients are certainly all feeling it. I thought that I would enter this experience just pretty much talking about heightened anxiety and coping skills. But really what's come forth for a lot of my clients has been purpose and redefining their lives and really taking hard and close looks at the people that are on their bench, so to speak, who they spend their time with, the things they spend their time worrying about. So I think they've all brought this sort of the helplessness that they're feeling on a community level. They've really brought it home and tried to, attack what they can, so to speak, and control what they can. So I'm seeing a lot of different things. I'm seeing some of the retired medical professionals that I work with are making meals for some of the first responders because they're well aware of precautions. So they're using 30 and 40 years of a professional background to really support what's happening on the front lines. And it's improving their mood, it's helping them feel purposeful, and there's no denying that they're helping, and they're raising community this way. So they're building community with people that perhaps the link was only a professional tie, or they knew each other through another group of friends. So that's one thing I'm seeing that I'm really liking. And the other thing I'm seeing that's pretty amazing is some of my more anxious clients are really taking the whole mind, body, spirit thing to heart. And so they're getting outside. Again, they're not going on cruises. That's not the purpose, but they're going around their neighborhood, right? And they're meeting their neighbors. They're acknowledging their own community that they haven't had time to because we're all caught in the busyness of meeting the responsibilities of life. So I think what I'm seeing more than anything during this pandemic has been the resiliency of the clients that come to Elite DNA, Phil.
That's wonderful. So, Sasha, are you suggesting that there may be some silver linings here?
So I definitely think that we're able to tap into parts of ourselves that we're not usually challenged with, right? And so we can definitely go to bed and pull the covers over our heads. That's definitely tempting. This is overwhelming. The information is changing quickly. There's no place to really escape to, right? You can't go to Paris right now. You can't go anywhere. The whole world is coping with this. But I think the beauty is that we're finding our own strengths, right? And the parts of our lives that we can make changes in. And even, like I said, redefining how we participate in our communities, which is always the domino effect of goodness, I think, Dr. Bloom.
So what do you think is one thing that we should all be trying to do more of during this pandemic to help us cope better?
So I think that connection is medicine. I think connection has always been medicine. And even though now people consider this limited, right, because we have this, but we do have this. And so even though, like the retired medical professionals that I discussed, even though they're not physically in these hospitals, right? They're not physically having lunch with these individuals. They're feeding them. they're bringing them to the hospitals. So there's still connection. And when these professionals go home, the volunteers are the people they're talking about. So really very deep community is being built. And I'd be surprised if there weren't some sort of connection after, after this. I think people are also building their skill set, beyond what they can do for themselves at home. They're thinking about, what can I do for my daughter who's a nurse in Michigan? What can I do for my kids who are bored? What can I do? So it's a different mindset, which is a different perspective, which I think is always healthy.
I think that's awesome, Sasha. And so, we're talking about the things you're hearing in your therapy sessions, but kind of give the viewer a little bit of an idea of really, what is therapy? How can it help them, especially now? And what are some of the things that, Elite DNA is doing to really help their patients?
So I think the beauty of therapy, regardless of what's happening in the world, is that it's such a safe space to process, right? It's a safe space. It's a safe space. I can't emphasize that enough. And the relationship that's developed is one that's very unique because it's intimate on so many levels, but it's facing things that perhaps, our friends just aren't equipped to face, and our families just don't want to, right? They want to have with us. They want to enjoy vacations with us. They don't want to process our trauma from 5 years ago. So I think that therapy is unique because we're able to really reach the parts of us that perhaps keep us up at night or don't help us in our relationships or hinder us in our work environments, right? And how we navigate our lives. And we're able to uncover that and come up with solutions in a very safe way. And the reason I love Elite DNA is because our practitioners are as different as our clients. And so, when clients come to Elite DNA, it's really not, okay, next. It's really taking a look at the whole person, which is such a social work view. And looking at, what else is in this person's life? I know they're saying depression, but what else am I looking at? And finding the practitioner, whether it's gender or practice or skill set, that will help this person in the most holistic way. And I just love that about our agency. And we're responsive. We don't sit on our laurels. We don't sit by and watch people suffer. We are always trying to improve. We're always trying to work holistically. We're always trying to improve. It's an amazing organization in terms of mental health because we really do care about the entire person from the minute they walk in our doors.
Yeah, and I think your comment on being responsive is extremely important to Elite DNA. One of the things that I know that we're doing is patients can do a virtual walk-in session. So they can actually go on our website, elitedna.us. They can click the, Be Seen Now button and be, in a session with a care coordinator within 5 minutes. And so I think that's a huge piece, as you mentioned, in responding to the community, we want to be able to help. And so if anybody's interested in getting services, they could obviously call us. They can go on our website, or they can, again, do that virtual walk-in. And so amazing therapists like Dr. Bloom and Sasha are available and are taking new patients. And I think that's extremely important, especially now with all that's going on out there.
Absolutely. I so agree. And for the most part, limited in our interactions, being able to walk in virtually in that moment that it becomes so urgent is a game changer for many, many people.
No, not without our glitches, though.
Yeah.
Do our best.
Well, I so appreciate everyone's time today. And Sasha, thank you so much for taking the time and talking with us. And again, after hearing what you had to say last week, I thought people should really know about this and should really know about what they could be doing, during this time, especially having a lot more free time, maybe getting with a therapist or just taking some of the tips that you mentioned. So thank you, Sasha, for your time.
Thank you for inviting me.
Absolutely. As always, Dr. Bloom, it's a pleasure. And we look forward to the next Mental Health Minute next week.
Okay. Be well.
Thank you.
Bye, Dr. Bloom. Bye.